Um, Good afternoon, colleagues. I'm going to make just a few reactions from a policy perspective on three different presentations. And my name is Betty Kyaddondo, as already introduced, and I'm very, very honored to be participating in this webinar on family planning. So I first of all want to thank the previous presenters in their different capacities who have shared with us research findings, programmatic issues, as well as some policy considerations on improving family planning in our different countries, but also across regions and the entire world overall. So I want to start with the last presentation of Ms. Ramato Daroda on food procurement solutions for essential health commodities in the East African community. And I'm starting with this because without commodities, there is no program. So without contraceptives, we don't have family planning programs in our individual countries. And in pursuance of our national action plans for family planning, for Uganda, we have a National Family Planning Hosted Implementation Plan, and I'm sure other countries have this as well. National governments are mandated to accelerate efforts for provision of uninterrupted family planning services and commodities to eligible populations across different countries. And one of the avenues, and I'm in full support of what Daroda has raised, that governments need to adopt the full mechanism for contraceptive procurement. There has been a lot of support that has definitely come out, and in Uganda, mainly from USAID, from the UK aid for integrated supply chain management and procurement for taking into consideration the East African communities. And we are all aware if this is implemented very well, this pool mechanism would lead to resource efficiencies. We already have inadequacies in resources. So if we pull commodities, we're going to increase efficiency in resource utilization. We are going to have assured quality assurance for the health products and especially family planning commodities. And we are going to have more internationally produced products within our countries. One of the biggest challenges, and I think which was raised from the presentation of my sister, a lawyer, but also from the presentation from my sister in Zimbabwe, is the high population growth rate within our countries, and the unchecked growth rate of the population is one of the root causes of all the problems for us in the East African countries. No amounts of economic development can fulfill the gap of resources for the alarmingly growing population. So to ensure sustainable contraceptive commodity security, there is need to achieve the economies of scale and use funds more efficiently as defragmented procurements and small volumes have less appeal and do not attract international bidders. So this would work, this kind of procurement would work very best in our circumstances when we have the different experts sitting and discussing together on round tables. And this would also attract competitive bids and internationally produced products. So I want to link what has been presented by Daroda to what my sister Judith Arroyo's presentation highlighted. So linking this from the different slides that Dr. Aloya has given us, she showed that one of the gaps that they have experienced through this program in northern Uganda is in data management, poor stock management, and the inefficiencies in the health management information systems, which question the quality of family planning information. And therefore, from the policy perspective, there is an urgent need to improve family planning information systems to ensure commodity security and management for the health sector. And in addition, national procurement plans must be monitored on a regular basis and should include contraceptive commodities, quantities, as well as the timelines, as well as the budgets, the scope, the coverage, but also the target areas. And we are all aware that well-functioning supply chain that meets the demands of our public and private sectors play a critical role to reducing the unmet need for contraceptives. And therefore, this takes me to what my sister Sibola has been speaking about. Lack of access and supply chain failure are the principal reasons for the non-use of contraceptives and contraceptive discontinuation. I will use a few examples to highlight this, but also draw my policy reactions and conclusions. For example, in 2017, when we were preparing for the Family Planning Summit in London, countries were requested to make expanded commitments built on what we had made in 2012. And one of the commitments that Uganda made was to ensure that government of Uganda raises annually $20 million through continued partnerships and with development agencies, the private sector. So I was saying government committed to raise $5 million from the government coffers and also mobilize $20 million from our friends across the world through partnerships with development agencies, the private sector, but also with corporate agencies. And the main reason why we needed to have this money was to ensure that we address the unmet need and improve access for family planning. So the other policy implication that I wanted to share is ensuring that if we improve quantification through increasing budget allocations, we're going to see more wide range of family planning commodities procured. And this will address the issue of the low uptake of the long-acting and reversible contraceptives that have been highlighted in both presentations. And then one of the other areas that was touched is ensuring that we have a robust social behavior change communication strategy to increase demand and link family planning services to the communities. And this will help dispel the myths and misconceptions that have been raised in the presentations and increase family planning uptake. And then there's also need to strengthen community systems, including the community gatekeepers, but also ensure that we work with community health workers and the family unit to increase family planning uptake, but also reduce the unmet need. And then lastly, we need to commit to expand the cadre of skilled workforce to pursue quality family planning services, including the long-acting contraceptive methods. And this will be ensured through improving task sharing policy, which has been very well discussed, but also issues of training the cadres and training, especially for youth-friendly service provision, because we've had there's a very high unmet need among adolescents. Then we also need to consider using the integrated multi-sectoral approach to implement the national adolescent health policies in our different countries, and also increase access to quality sexual reproductive health services and link it to development, especially for the adolescents. And I agree entirely with the digitalizing family planning information through either mHealth or telehealth programs to bring information and services very close to the adolescents. And then what is the missed opportunity if we don't invest in family planning? I think we need to, in all our discussions, link family planning programs to national development. And we have done this in our country. It is delivering results more than ever before. So thank you very much, ladies and gentlemen, for giving me your audience. And also, thank you so much, the organizers, for giving Uganda an opportunity to speak and react.